You know, one of the things that Mississippi is number one in and not really proud of is obesity. A lot of people that are overweight. And it's just a kind of, our lifestyle down here, whether it's on the Gulf Coast or up in the Delta or whatever. Well, today on the show, we're at the South Mississippi Surgical Weight Loss Center in Ocean Springs. And we're going to talk about different avenues that you can take if you have that problem or you have a loved one that has that problem. Tish Hancock is the dietitian here. How are you?
I'm doing well. How are you?
I'm doing well, thank you. Tell us about yourself and why you got involved in this.
Well, I'm a registered clinical dietitian at South Mississippi Surgical Weight Loss Center, and I have a master's in nutrition science, and I specialize in weight loss and maintenance, nutrition education, and medical nutrition therapy for those with special nutrition needs.
Now, one of the things that we don't like to use the terminology, it's changing, is diet.
Absolutely.
And people, you say diet, oh, I can't go on a diet, I don't want to go on a diet, something like that. But the term lifestyle change, that's cool.
It is.
It really is.
In fact, what we do at our clinic is we have a comprehensive program for all people who have dietary needs. And for those who want to lose weight, especially, we have a lifestyle diet pattern that we follow. And we pride ourselves in the fact that it's
a weight loss journey, so to speak.
It is a weight loss journey. And we pride ourselves in the fact that that weight loss program that we give does not cut out any food groups unnecessarily, but it's something that people can, follow easily because it's real foods. It's not, foods that you can't easily find on the Mississippi Gulf Coast.
Right.
And so we have a program that kind of encompasses everyone's dietary likes.
And you have, and you don't just put them on this lifestyle change and say, okay,
Diet.
go, diet, or and say, okay, see you later. You have support groups and everything that help them out.
Well, we're very comprehensive in the fact that we have something for surgical patients and non-surgical patients, for people who may not qualify for weight loss surgery and just want to do it on their own. We also have the OptiFast program, which is a little bit different. It's a aggressive, medically supervised meal replacement diet. It's a 12-week program, but can be a little bit longer. And what we love about this program is that we use nutrition education on a weekly basis. So we're not just sending someone home and saying, here, use this, product,
right,
and then not giving them skills to be able to do this on their own later. So we are full of knowledge and power at South Mississippi Surgical Weight Loss Center, and we like to empower our patients with the same. So what we do is we have a very comprehensive nutrition program. We stay with our patients post-surgery with support group, like you had mentioned, and even extra education once they go on their journey from us.
Well, as you mentioned, there may be an opportunity where they do need to have surgery, and they have a wonderful bariatric surgeon here in Dr. Avery. So let's talk to him right now. Dr. William Avery is the bariatric surgeon here at the South Mississippi Surgical Weight Loss Center. Dr. Avery, good to see you again.
Good to be here. Good to see you, Gene.
If you would tell our audience a little bit about yourself, your background.
Sure, I'm a general surgeon, but my practice has been bariatric surgery for over 10 years, and that's really what I devote most of my time to, is thinking and about obesity and how to treat it.
Now, how many surgeries do you think you performed during that time?
I don't know exactly, but it's probably over a couple of thousand.
A couple of thousand. And as I mentioned before, state of Mississippi, unfortunately, is number one in obesity. And in talking to Ms. Hancock, there may be some that are able to fight that battle with diet, changing their lifestyle, but there may be those that actually need to have surgery, and that's where you come in.
Obesity is clearly an illness, and it's progressive. And early on, if you can stop it and get people's weight under control, then these other methods work well. But once people become morbidly obese, where they are clearly ill or becoming ill from their weight, nothing but surgical treatment in 2014 is going to really make a difference in their lives.
Well, it used to be you see somebody that's obese, you would just say, in your mind, oh, they're just fat. But obesity, actually, in the last few years, it has been deemed as a disease.
I don't think there's any question. I think most of us now come to the conclusion that obesity is an illness, and we can't blame the patient. It won't help.
No.
None of these folks want to be this big. They just can't control it any more than you could control your blood pressure by wanting it to be down. So we have to find ways to treat obesity, And today, surgery is the most effective, the most durable method that we have.
What types of surgery does the South Mississippi Weight Loss Surgical Center offer?
Sure, we're a comprehensive surgery program. There are three main surgeries in the United States today. Gastric bypass, which has been around a long time and is still the gold standard, but we don't use it as much anymore. Sleeve gastrectomy is the latest and greatest, and it's been around almost a decade, and it's really what people are flocking to. We still use the adjustable bands, the lap bands, and I
Right.
still like those procedures because they're very simple and reversible, but the sleeve gastrectomy works so well and is proven to be so safe and durable that that's really what people want to do.
So basically, does the sleeve
Sleeve
gastrectomy?
what we do is we just make the stomach much smaller, and that's really all there is to it. We're not sure exactly how it works. It's clearly because people can't eat as much, but we're learning that the stomach is a complex organ, and there are things that go on in the stomach that change your response to glucose, which is why so many people with obesity and diabetes can see their diabetes resolve long before their weight begins to fall, which is just amazing.
Now, and it has been found that surgery is to the point where it's the best way to treat obesity.
I think the standard of
Morbid
care,
obesity.
I think the standard of care today, recent studies have shown that if you have morbid obesity and diabetes, surgery is the only reliable way to get a long-term control of your diabetes. And what many people don't understand is the complications from diabetes, the heart disease, the cardiac disease, the renal disease, kidney disease, strokes and things like that are diminished greatly when their weight gets under control and their diabetes gets under control.
I love this picture that you have here of this young lady
That's
before and
fabulous.
after. I mean, it looks like just two totally different people. And as you mentioned, you gave it a little analogy before we started taping about looking at someone like this.
You know, we tend to blame people for their weight, which is wrong. It is not appropriate. But when their weight changes, we think differently of people, and we just have a bias, and we have to work past that. And it's with children, it's with adults. We've got to learn to prevent obesity, but we've got to understand that it's caused by something that we don't yet understand, but it's not the patient's fault. We just got to take care of people.
Dr. Avey, thank you so much for your
Thank
time.
you.
If you'd like some more information about what they offer here as far as the surgeries, any of the different surgeries that they do have, if you have an obesity problem, talk to your doctor, and of course they'll be glad to give you a recommendation to come over here and talk to your group. Again, thank you so much.
Thank you, Jim.
South Mississippi Weight Loss Surgical Center here on the Mississippi Gulf Coast.